First of all, to the presenters, thank you so much for taking time out of your busy day to come and talk to our students. We really, really do appreciate it. And so we're just going to start off, and thank you for coming as well. And President Schwartz is just going to start us off.
Great. Move over here. As a health sciences and professional programs campus, UMFK is committed to providing our students with educational opportunities that will help you in the world ahead. Careers in the health sciences, in various aspects of business, behavioral sciences, forestry, and the various other programs that we offer. As you look at Maine's aging population, of course, as you know, Maine is the oldest state in the United States. And as we're confronted with the nursing cliff and the demand for more and more nurses, we're committed to making sure that we graduate more nursing students, that we have more BSN students to serve the needs of our state. We're also linked together with other healthcare programs to make sure that we have interdisciplinary programs and that we're working with local employers. When you look at the needs of the state of Maine and the nation, we're committed to helping. I want to thank the sponsors today. I want to thank Sue Bay and Nick and Tammy for setting this program up. Thank you for being here today, and especially I want to thank you for being here today to talk to our students. This is one of the many programs we hope to do to make sure that our students are ready for the careers that we have in the county, in the state of Maine, and in the nation. Thanks so much for taking the time to be here today. I'd stay for the program, but I have an executive session of the Board of Trustees committee meeting that we rescheduled to a Zoom meeting because several campuses in the southern part of the state are closed today, but we were able to use technology and Zoom, so I'm hoping to attend that. Again, thanks so much for being here.
All right, so this week is Career Week at UMFK, so you guys are kicking this off for us. And other things during the week are mock interviews. We have an etiquette dinner. We have a resume contest. So the students are really, we're trying to plant that seed for them to be aware of. So we appreciate you being here. Hopefully you can share with the students some of what you guys are looking for and how we can be better prepared to be employable. So thank you for coming, and the students, thank you that are here to participate. I hope that you realize the benefits in today's session and talk to me more about how you can participate in Career Week this week, all right? Thank you.
And now Erin Susie is going to come up, and she's going to be talking about the nursing program as well as introduction to the presenters.
Most of you know me. I recognize most of you, but for those who don't, my name is Erin Susie. I'm the Dean of the Nursing Program here at UMFK. And some of you know, and some of you may not know, that we also have our nursing program in Vesta and in Costano, so it's branch campuses. So we're part of a good-sized nursing program. It's my pleasure to be here with you today. I thank all of our panel presenters for taking time to be here. Thank you, Sue. Most students will tell me I talk enough and loud enough that I don't need a microphone, but you know, if you're willing to give me one, I'll take it. Some of you have heard me talk to you about our program outcomes and that your curriculum is really structured around the Maine nurse competencies. That's important to you because most of the healthcare organizations in Maine also use the Maine nurse competencies to evaluate their staff. So you're really being educated using a framework that is widely accepted. We adopted our competencies from the state of Massachusetts, and several states have adopted those same competencies. So they're very commonly accepted as the most important things you need to know when you graduate, and what our employers are looking for when you graduate. So there's 3 areas where all students learn, where all humans learn. And so if you have an opportunity to look at the main competencies, you'll see that they're broken down into knowledge. So it's the things that you learn about when somebody's lecturing to you, like right now I'm lecturing to you about the competencies, right? So you're learning maybe something you didn't know before, or you're being reminded of something you're familiar with. And then there's attitudes and values. That's very important. It's one of the hardest things to teach. It's also one of the hardest things to evaluate. But we do spend a fair bit of time talking to you about, here is the way that you need to behave when you're in clinical. Here's the way you need to dress. Here's some of the attitudes we want to see you display. Here's some of the behaviors it's important for you to adopt. And then everybody's favorite is skills. And that's what was my favorite thing to teach when I taught in the lab and in the clinical, was teaching psychomotor skills, clinical skills. They're fun, right? Most people like that. It's fun to learn how to manipulate equipment, and it's fun to practice on the mannequins and then to actually do things with patients. So that's a very important part of learning too. Most people would argue it's not your most important part of learning. Most people would say your most important thing is to be able to think critically, to do your assessments accurately, and to communicate. And usually what most people would argue are the most important things. Technology changes, skills change, things get updated, the way we do things changes because of evidence-based practice. So you'll hear a lot of emphasis about that in our program as well, about your behaviors, your open-mindedness, your willingness to learn new things, to always have that intellectual curiosity. So we applaud you for that, and that's one of the reasons why you're here, right? It's because you want to know more. So that's a good thing. The other thing that you're going to find that we talk to you a lot about is career readiness. We work very closely with Sue Dubay and with Tammy Delisle's office to try to make sure you're ready for your careers. Make sure you know how to put a resume together, how to answer interview questions in a job interview, some of the behaviors that would be expected of you, and what people want to see you able to do when you graduate. So we also spend a lot of time working with you to help you get ready for that, because that's why you're here. You're not here because you want to be students forever. You're here because you want to become nurses, and you want to learn how to take care of patients in ways that are competent and safe, and you want to feel satisfaction from your career. So those are some of the things that we will emphasize more and more as you go throughout the program, and especially towards the end of the program during the preceptorship. We're really helping you to bring everything all together. How many of you in the room are juniors? And how many of you are sophomores? And how many of you are freshmen? So we have some freshmen and sophomores. Do we have any seniors here? I don't recognize any seniors. Okay. So that's good. It's good for you as freshmen. I'm glad you're coming here and learning more, and sophomores, and then juniors are, you guys already know everything, right? Nothing more to learn. So it is my pleasure to introduce you to our colleagues. Most of you are familiar with Dr. Stacy Thibodeau. So Stacy comes to us most recently from Florida. She was the director of all clinical services at Kindred Hospital in Melbourne, Florida. And while she was there in her short time there, she was able to help them achieve national status in respiratory care. So she oversaw every clinical person in the hospital, not just nurses, but the physicians, the X-ray lab, respiratory therapy, all the way down to environmental services, all the way down to laundry and housekeeping. So she had a lot of administrative experience. And prior to that, she was in charge, the director of public health, Augusta North. So she oversaw most of the state in terms of public health. She has expertise in obstetrics and pediatric nursing, which is a rare find for us in northern Maine. So we're delighted to have her here as a faculty member. She teaches here in Fort Kent and on the Pascal campus, so she does both for us. And Stacy actually was a participant in JMG herself. So I thought it would be especially nice to have her with us today, and so she can speak. She's also served as our clinical supervisor, so she can speak about some of the clinical expectations that some of our juniors are experiencing, and so that some of our sophomores and freshmen know what to expect when we get to be at that level. And then seated to my left is my esteemed colleague, Jane Lemieux. Jane is the, I'm going to have to look at your exact title, the clinical supervisor for Merced County for visiting nurses. And she's also here representing Northern Light Healthcare, which is one of the largest healthcare organizations in our state. So that includes They are Gould Hospital in Prestal, the artist formerly known as Panic. It includes Eastern Maine Medical Center, Acadia, the hospital in Ellsworth, Rock Harbor, several nursing homes, a couple of retail pharmacies. It's a very large healthcare organization, and all of you will do some of your clinical rotations in our organization before you graduate. So she's just here to represent them. Next to her is Mrs. Heather Pelletier, and she is the Executive Director for Fish River Rural Health. And so she's their administrator there. And next to her is Denise Raymond, and Denise is the administrator for Mercy Home in Eagle Lake. And Alain Bois, and Alain and I just figured out that we're the same age, so we're both 25. And Alain Bois is the Chief Operating Officer for Northern Maine Medical Center in Forest Hill, and he's also the Director of Nursing Services there. So he wears multiple hats, like many of us do. Priscilla Dien is a graduate of UMFK's nursing program. She has worked in a variety of different clinical areas and has also served as one of our clinical instructors. Most recently, she accepted the position as Director of Nursing for Ridgewood Estates, and they're very delighted to have her. I'm always hearing good things about Priscilla. And then last but certainly not least is Kathy Roy. She's also a graduate of the UMFK nursing program. Kathy is the administrator for CrossFit and the St. Joseph's Memory Care in Frenchville, Maine. And she has developed a lot of expertise, not only in business, but in healthcare. So she's really a nice blend of administration and healthcare backgrounds both. So we're delighted to have such an esteemed panel, and I thank you very much for coming, all of you, taking time out of your day. And I'm glad we're not getting too much stormy weather today. Grateful for that. And I think that I'll let Stacy speak first about your clinical experiences. And one thing important for all of you to know too as students is that we do meet very regularly with our clinical practice partners. Typically once per year we meet and just talk to them about what's going well, what could be going better. And then every 4 years we have what we call a gap analysis. So we did that last summer before last. So a gap analysis is we invite them to come, they spend the whole day with us, and they give us tons of feedback. And we go through every one of those program outcomes to determine what's going well, what could be going better, what is unique about UMFK graduates, what's just in general, all graduates, what sorts of challenges do they have when you employ them, or what kinds of challenges are you seeing them struggle with as students and as new nurses. So that's very useful. And the reason why we only do that every 4 years is because we make changes to our curriculum and we want to see if they were effective. So it's kind of like we're applying the nursing process, but to our program. So we do a lot of things behind the scenes to make sure that you're getting the highest quality education possible. And you all know, and they certainly appreciate how heavily reliant we are on their goodwill and their good grace to let us do so many clinical hours in their facilities. So I'd like us to give them a round of applause and appreciation for all they do for us in our program. Stacey, I'll turn it over to you.
Thank you. So this is going to be my second semester going into UMFK nursing program, and I was warmly received last semester and this semester. I do have a new role as the clinical supervisor. Last semester, many of my junior students came to me and they were like, oh, we just want a little bit more out of our clinical. So I met with several of them. I met with Dr. Susie, and we sat down and we said, okay. So at the beginning of this semester, we kind of revamped our whole clinical outline and how we perform. One of the most important areas was our professionalism. And for those of you who saw my hour-long PowerPoint presentation on professionalism, it's really key. Our patients see us, our communities see us. We have the knowledge, we have the skills. So when we go out, we need to ensure that professionalism also meets that standard. For me, as being the clinical supervisor, I want to make sure when we go into each one of our patients' rooms that we're not only just meeting their expectations, when they walk out, that patient, that family member says, wow, we have exceeded their expectations. So not only do we ask them the patient themselves if they would like some water, or can we get them a warm blanket, but we also ask that family member. Okay, so that patient-centered care, we have a patient at the center, but without each going out each circle, we have family members, okay, we have communities. So we have to make sure that we incorporate their cultures and everything and exceed that expectation. So that's going to be really important going into clinicals. And we're continuing to update and make new improvements with the faculty, our partners. I go and meet with them, and they can give me feedback about where we can improve. Students do meet with me often, at least once a week. I have students come and give me great ideas about clinicals, which we incorporate. Our clinical supervisors and for the clinical structures, they also have had new input and new directions as far as our forms, giving feedback to our students. So these are things that we really think have incorporated into the program more so. And feedback from our students, of course, is of the utmost importance, and we value that. So we, as we continue to keep giving us feedback and not only meeting that expectation for our patients, but exceeding them. Because when we go into our partners, we are an extension of them. And each one of the hospitals and organizations back here, when they go in, they want to exceed those patients' expectations and their families. So them allowing us into their organization, we are their extension. They've given us that trust, and we want to make sure that we uphold that, and we are representing each one of their missions and visions when we go into our facilities. So I encourage you all to always exceed the standards. No one wants to be a marginal nurse. We want to be exceptional. So go with that, your mission and your vision in nursing. So, sorry to go on, but
That's so important. Yes. Yes, we are all passionate about patient care excellence for sure. It's always our focus. Just like our focus is your quality education, your focus in the clinical settings, quality patient care. I'll turn it over to Jane.
Well, Karen, I don't think I need that. So my name is Jane Ryu, and I do work for Northern Light Home Care. And I'm pinch hitting today because our recruiter was ill, so I found out a little while ago, not that much, a while ago, that I was going to come and speak today. But first of all, I'd like to congratulate you all for choosing the field, because we need more nurses. Because I am always looking for my replacement, because I hope to retire soon. I've worked with almost everybody on this panel. A long time ago, and I'm probably the oldest one on this panel. But every day in nursing, I've learned something. It doesn't matter how long you've been a nurse, you learn something every day. And the day you stop learning something is the day you need to think about maybe you need to do something different, or but you learn every day in nursing. So let me tell you a little bit about Northern Light. We have 9 hospitals in our system, and we have a standalone psychiatric hospital. We also have a home health and hospice, and that's where I work, so I might talk a little bit about that more than the others. We have a pharmacy, we have lab services, and we are also in long-term care and skilled care, and we do have an emergency transport system. We do cover the whole state of Maine, from all the way from Allagash all the way to southern Maine, for whatever type of service you may need. So we also, as a agency, what are we looking for in an employee? What are we looking for a nurse? We are looking for someone who's committed to what they do, be exceptional. You want to provide exceptional care. You want to be that exceptional nurse. We are looking for somebody who's going to treat all our patients with dignity and respect. We're looking for somebody who's not afraid to work hard. We're looking for people who are compassionate. So you're right, Erin, it's not just about skills. It's about being able to think on your feet and being able to think quickly on your feet sometimes. What do you do when that patient's crashing? You can't just stand there and will you do that? Absolutely. You're going to do that one day. And there's nothing wrong with that. It's just knowing where your resources are. So we're looking for people who are committed. And being a nurse is not just a career choice. It becomes part of who you are. You're going to be a mother and a nurse. You're going to be a wife and a nurse. You're going to be a daughter and a nurse. And that all blends together. And the longer you are a nurse, you can't separate the two. All right? So I love to come to pinning because I always get refreshed when I come to the pinning ceremony in May. I just sit there, even if I don't know the people graduating. I think it's an awesome ceremony, and it refreshes me. It makes me feel good about being a nurse. So congratulations with your field choice, and I get passionate too. What opportunities are there? For Northern Light Health, we have a really unique program. We offer a residency program in all our areas that we have. And so I'm going to talk a little bit about home care right now. Maine legislature had a rule that a new graduate nurse could not work in home care. And last year, the year before, Northern Light Home Care presented to the State Board of Nursing a program, a residency program, allowing a new grad to work in home care, and it's been successful. Essentially, that new grad, we say, is on orientation for a year with certain milestones that they need to meet, but you're working side by side with a nurse, and then after, I think it's about 3 to 6 months, you are able to go out on your own, but there are different projects and steps that you have to do. And it's really been, it's been wonderful to see our new nurses grow in the field. We also, in Aroostook County, have what's called the House of Comfort. So if you're interested in hospice and palliative care, the House of Comfort is a beautiful 6-bed facility to help people who are in hospice care. We use it as what's called general inpatient. If someone's at home in hospice care and needs some help with pain and symptom management, they might go to the House of Comfort because it is, we have nurses that work 24/7 that can help them manage their pain and symptoms. But hospice is another piece of what we do. It's a wonderful experience to help people through that process, not only a patient, but the family member. And we'll be starting, we have started, it's called the Palliative Care Program, which is kind of an in-between home health and hospice. And our palliative program is working in our southern parts of the state. It is coming to the northern parts of the state. So that's a little bit about who we are and what we do. And if you have any questions, I think there's a question and answer period. I'll do the best that I can to answer them. Thank you.
Thanks, Jane. I wrote notes so that I don't go sideways. I get passionate and then I say one thing. So I'm Heather Bellatier, CEO at Fish River Rural Health. Sue had asked us to give an introduction of our institution. So we are a federally qualified health center. This is a standalone nonprofit 501c3. We do appreciate, we have a couple of FQHC colleagues in the county. We neighbor one another, so you might be familiar with Pines Health Services or Platte Valley Health Center. Those are the 3 federally qualified health centers in Aroostook County. And I believe Erin is looking to set up precepts in these locations. So there's 16 federally qualified health center locations in the county. We began under the CAP agency, so in 1978, we began in a mobile unit that looks a lot like a bread truck today. They've come a long way with mobile units. We no longer have a mobile unit, but that was 1978. Fast forward, in 1990, we became designated as a federally qualified health center. So a lot of material you'll read about Fish River, we began in 1990, but truly we began in 1978 under the CAP agency. So we have folks that have been with us longer than 1990 because we're the same people. So we have physicians that have worked more than 30 years for us and nurses that have worked more than 30 years for us. Fast forward 2012, we purchased another brick and mortar, bringing that to 2 buildings. 2015, we purchased another, bringing that to 3 buildings, and then in 2017, we opened our 4th site. So we have 4 sites now between Needle Lake, Fort Kenton, and Madawaska. I don't know if you guys have seen in the paper, but we've constructed a 10,660 square foot expansion to bring a lot of our services together, and I know some of the people in the audience have come to visit. So. We have family medicine, behavioral health counseling, biofeedback, psychiatric medication management, RN care management, family dentistry, family optometry, podiatry, eligibility assistance, need families home visitation, school nursing, as well as support groups and numerous community outreach programs. So a lot of interdisciplinary care at all of our sites. In addition to our unique primary care delivery model, we're required to be governed by at least 51% of our board members who receive services as our patients. So this requirement ensures the patient voice governs the direction of the federally qualified health center program. Employees and traits that Fish River looks for. We're looking for mission-minded individuals that demonstrate genuine compassion and a desire to make a difference in the communities we serve. Our mission at Fish River is to provide access to comprehensive primary preventive care of the highest quality to the underserved population and to improve the healthcare status of the residents of the Upper St. John Valley. I would describe our culture as humble and kind. We look for honest individuals that serve from the heart. So I think we've heard from our panel already that that is as important as the technical skills. We always say if you're serving from the heart, the rest will follow. Career opportunities. Sue would ask that we talk about some career opportunities, and my understanding is we have Health Allied in the room, so more than nurses in the room. What I would say for Health Allied, above and beyond nursing, so I'll start with nursing, the registered nurses that work are either office nurses, care management, or even management team members for us at Fish River. We also have medical assistants that are working towards their RN degrees, so we have a lot of folks that are in the RN program and looking to have clinical skills while they're in nursing school. So we do have medical assistant openings. And on the behavioral health side, we have licensed clinical social workers, licensed alcohol drug counselors. We even have registered nurses that specialize in behavioral health. So they do motivational interviewing, and they work with our behavioral health and substance use case management services. We even have a bachelor health graduate from UMFK that works as a behavioral health specialist. So she's not an RN, she's a behavioral health specialist with a bachelor training from UMFK. And she works with our psychiatric mental health nurse practitioner in taking patients, setting up biofeedback sessions, and other behavioral health patient needs. So just to offer you some ideas about the behavioral health opportunities at Fish River. And then we also have some data analysts that work for us, and they're UMFK graduates as well. I would say of our college degree employees, at least a third of them are UMFK graduates. So between nursing, behavioral health, and data analytics and quality, we have a considerable amount of UMFK students working for us, for graduates, I should say. Our quality data analysts will provide us patient population health information. They assess clinical performance and patient health outcomes. We have a lot of preventive programs. One example is Million Hearts. We identify patients who are at risk for a cardiac event before a cardiac event occurs. We enroll them in an evidence-based preventive care program. We assign them a family provider, a registered nurse, and we work to reduce that identified cardiac risk. And the cardiac risk score is 30% or greater. Hopefully, we're preventing a heart attack or stroke. And the reason for Million Hearts is to prevent a million heart events by 2020. And so this began several years ago. And I am proud to share with you that we have made a difference in a lot of our cardiac risk scores in this prevention program. This is run by Centers for Medicare and Medicaid, and Fish River is one of 4 healthcare entities invited to participate in the Northeast. So if you were to go on the CMS website and click on Innovative Programs and click on Maine, Fish River Rural Health will come up as one of the prevention innovation programs. So our data analyst, being UMFK graduate, is at the helm of that program. I would anticipate the growth of prevention programs to increase for HIT graduates. So if there are any information technology graduates in the room, or we have friends or colleagues that are interested, I would say definitely there's a future there in healthcare. I anticipate the need for all UMFK's valuable health allied programs at Maine's federally qualified health centers. And statewide, we're one of 20. There are about 70 locations throughout the state of Maine, so there are a lot of federally qualified opportunities. We offer competitive benefits that include health insurance, life, disability insurance, retirement, as well as being eligible for scholar and loan repayment and tax credit programs. There's a generous CE investment for employees to invest in lifelong learning and professional growth. I serve on UMFK's Board of Visitors because I wholeheartedly believe in our community connection and investment. UMFK prepares students for today's healthcare environment. Thank you for inviting me to share Fishville Rural Health's numerous career opportunities with our future workforce. Thanks.
So I'm Denise Raymond. I'm the administrator of Mercy Home and Franciscan Home in Eagle Lake. We work under the business of Northern Maine General. Talk a little bit about Northern Maine General, but focus more on the programs I run. So Northern Maine General started in 1907. So we're over 100 years old, and we have multiple programs from our waiver homes where we serve mentally disabled residents. And they are 6 or 7 homes throughout the county. Folks that are interested in social services or behavioral health, definitely a good starting point, especially learning a lot about care planning in that program. We have a lot of case managers that either focus on mental health or developmental disabilities as well that work throughout the county. And again, a great starting program or someone with social services that can grow. We have mental health therapists. We have a couple employees throughout the county, either stationed in our Caribou office or in our Eagle Lake office. As well as IT. IT is very important in any social service field, no matter where you're at. IT pretty much runs a lot of the show and gets you to have electronic medical records. Very important role. And then of course, I'm not sure if any of you guys are in accounting or business management, but definitely a lot of opportunities for billing or coding. Coding is a definitely big thing right now for diagnoses, whatnot that we have as well. So what about Mercy and Franciscan? Franciscan is a 16-bed mental health residential care facility. Every resident that lives there has a mental health diagnosis. So our folks that tend to work there don't have college degrees quite yet, but they're working on it and are trained in mental health. The major training that we take is the MHRTC. If any of you guys are in the social service program, you probably have heard about the mental health rehabilitation technician community program. This is a little bit of a step down. Don't need the college education, but definitely a good growing point if you're interested in social services. We do a lot of mental health implementation of care plans, getting to know the resident, engaging with them, and rehabilitating them to hopefully move back out in the community. So that's a 16-bed facility. The nursing home is a 40-bed licensed facility for nursing and skilled care, and a 10-bed residential care facility with no mental health diagnosis attached to that residential care. So overall, Mercy has 50 licensed beds. The nursing home is a 5-star rated nursing home through the, as Heather mentioned, CMS. Medicare and Medicaid services rates all nursing homes throughout the United States, and we carry a 5-star. So we get surveyed annually. Spontaneous, unannounced surveys come in, and when they come in, we've rated very well in our surveys, which has resulted in 5 stars. Well, one of the reasons why we could get a 5-star rating. So that's a little bit about who we are today. We are changing a little bit. Hopefully within the next year, we're going to have a whole new unit. So keep your eyes posted. You might see something new that might interest you. So for the job opportunities we have for nursing, nurses is definitely obviously the forefront of what we do at the nursing home. CNAs also are highly important in providing the care under the supervision of the nurse. So if you're not quite a CNA, but you want to get your feet wet with healthcare, certainly there's like housekeeping and dietary positions. ResCare has some on-the-job training where you pass some medications. A lot of nurses want that experience before they become a nurse on medication administration. Our residential facilities, whether it's waiver, ResCare, or Franciscan, offer all those opportunities. We do on-the-job training where you get trained about 40 to 50 hours in a classroom, and then do some clinical supervision with the nurse, and then you get certified as a med tech, and you can administer medications. We do those same positions also do blood sugar checks and administer diabetes. So You don't quite have to be a CNA to start in our facility. You can be, you can be that freshman, you can be that sophomore. I know a lot of the junior nurses are ready to go out and be that CNA and then jump into nursing. So there's plenty of employment opportunities at North Main General, hopefully Mercy Home. Of course, I'm trying to recruit for myself. Not selfish a little bit. Benefits. So yes, our full-time employees have an awesome benefit package. Our insurance is very competitive, comparable to school districts and teachers. Very good insurance package, as well as paid time off. Proud to announce that any full-time employee starting amount of days off per year, 28 days paid, which is 4 weeks, is less than a lot of time. And there's a lot of other perks and benefits that we offer. Part-time, also, you accrue your time off based on the amount of time you put into work. So it's hard to tell you how many days off that's going to be. So, but you still get the time off. I think that's all it. Professor wants to
Good afternoon, everybody. So my name is Alain Bois. I'm a registered nurse, and I'm the Chief Operating Officer for Northern Maine Medical Center. I've been there since 1994, so I've got a good understanding of the organization and what we offer. The hospital first started in 1952. They started to talk about it in the late 40s, and by the time they had the funding to build the old part of the section, which is kind of looks like the middle section, this was done in 1952. And in the 70s, they had an additional addition to the building itself in order to meet the demands of inpatient care. We're licensed for 49 beds, and we have a 24-hour ER. We've got an ICU. We do have our med-surg. We also offer skilled rehab facility in our swing unit. We now have a 15-bed swing unit capacity. We have, pretty unique is that we're the only hospital north of Bangor with Acadia, with Northern Light, that offers both child and adolescent and adult inpatient psych units. So they come in, either they're suicidal or they're manic from their bipolar disorder. We treat them 4, 5, 6, 7 days longer in our children's unit, do medication adjustment, and then we discharge them and send them home. We do have our OB unit that we're pretty proud of. And also we have our general OR, where we provide general surgery, lap, choles, appies, hysterectomies, and then we also do orthopedics, general orthopedics of hips, knees, fractures, shoulders, reverse shoulders. And then we have what I call our flying specialist. We've got a urologist that comes in that can do some procedure there. We have an OB/GYN that comes in just for the GYN aspect. She does surgery in our OR. We've got a podiatrist that comes in once a month and does that. And of course, in all of those areas, we hire nurses to provide the care and social services to assist our patients with that. We also own a 45-bed skilled rehab facility called Forest Hill. One of the key things that we've done over the years is try to diversify a little bit in order to help the mission of the organization and support maybe certain programs that don't make a lot of money, but we feel that the organization requires. So we've diversified and to try to keep that going. And the most recently, we just purchased in May and took ownership of a retail pharmacy in Madawaska that it used to be called MedRx, and we now call it NMCRx. And you're going to say, well, why are we doing that? Is because the pharmacists there have access to our inpatient and outpatient medical records. So from a continuity of care for the patients, if the patient's being discharged and they're confused about which meds they can have, the pharmacists there have access to the inpatient record, can go see the progress notes, and actually talk to the hospitalist just like that and get clarification for that. We are actually meeting later this week to do a, we call it a med-to-bed program, where we're going to offer patients at the time of discharge, if they want to have their meds delivered at the bedside, that we will have a courier process that is going to bring the meds from our pharmacy in Madawaska right at the bedside and be able to educate them with the actual containers of what the medication is going to look like with the right color, because they might be different on the inpatient side. So we're pretty excited about that opportunity. We hire all of our providers, either they're advanced practice providers such as physician assistant or nurse practitioner. We've got a significant amount of nurse practitioner that works for us, from behavioral health all the way to primary care. and are physicians. So 100% of them are hired within the organization and are employees of the organization. We are a 5-star also for the hospital by the CMS, where there's only, the new ratings just came out actually last week, and we are one of 3 hospitals in the state of Maine who have reached and maintained, I'd like to say that we've maintained a 5-star, and we are the only one that has what I call the double crown. We have 5-star in the quality of care, but also a 5-star from patients' perception of their experience with them, with us, so we're pretty excited about that. We have multiple committees that we encourage our employees to participate in, and we also have a shared governance program. We call that the NPQC, the Nursing Practice and Quality Council, where they help us shape the nursing practice at Northern Maine Medical Center, compare our current practices with evidence-based practices, and upgrade our policies and procedures. We've recently, in the past year, purchased 2 mannequins, and we now have an interdisciplinary sim lab. We've got Hal, who's a critical care patient, who's able to be ventilated and all of that. And we also have Victoria, who's able to do deliveries with us. And we have 3 different tracks where we offer ongoing educational opportunities. The first track is to assist our new nurses that are coming to join us, go from what they've learned in the clinical areas and in school and apply it to our practice at Northern Maine Medical Center. So I kind of bridge that. I then have a second track that is more for younger experienced nurses, 1 to 2 years. We might do some drills, for example, do a mega code or do a rapid response or something of that nature. And then I've got a third track, which is more for our experienced nurses, massive blood transfusions or full trauma or do rapid sequence intubation. So we've utilized that to kind of help bridge and ensure that our nurses are as competent as possible through real life scenarios. And I know many of you have seen the sim labs here and the capabilities of those mannequins, so we're pretty excited. We're the only hospital north of Bangor who also has the sim lab available. We invest heavily in technology. Every year we spend about $2 million on average invested in new technology. So for example, the latest thing that we purchased is that we replaced all of our inpatient beds with newly, highly technically advanced beds that talk to the patients when the patients try to get out of bed by themselves, that has lights that lights up on the floor that says if the brakes are on, if the bed exit is on, if the bed is at the lowest level that it can go. So at night, our nurses walking up and down the hallway can actually see if the bed exit has been activated on this bed, and without having to walk in and finagle through wires and things like that. Also right now we're implementing a new perinatal central monitoring station. So we've just purchased the GE Centricity, so our providers from home, either through their cell phone or through a tablet or through their computer, will be able to monitor the fetal heart rate and the contractions of the mom, be able to see where the Pitocin is at, be able to see how dilated the mom is, how we face the mom is. So that's the newest thing that we're currently purchasing and actually installing as we talk. We are on becoming a high reliability organization journey. You're going to say, well, what does that mean? It means that we're aiming for 0 harm to our patients. So just like the nuclear plants and things like that, we're working hard with our frontline employees, and we're really looking for people that are fully engaged to say, oh, time out, there's a potential patient safety here, or there's a potential employee safety, because it's not only for our patients, but if someone, for example, misses a paycheck on payroll because payroll made an error, and now they're focused about how I'm going to make that payment and how I'm going to make that payment, it may relate to patient care because they're not as focused as much as they should be. So we're looking at 0 harm across the entire organization and really lowering the risk of harming our patients. We are about to break ground in the month of April to a brand new addition, 24,000 square feet, a 4-story addition to our building that's going to house a new cafeteria, a brand new lab, a new behavioral health space for gym for them to go exercise, and then a brand new OR. Our OR currently occupies the same space as where it was built in the 1950s. It's been renovated, but it's still, the rooms are smaller. So we're breaking ground this April for a $12.6 million project. So we're pretty excited about that, and one of the biggest endeavors that this organization has taken over the last 20 years or so. What are we looking for in our employees is, number one is flexibility and adaptability. Being in a small organization, we've got to be able to do different things. If you go to a big health center to be a nurse, you may not have to start your IVs because there's an IV team to call in. You may not have to give your neb treatments because there's respiratory around the clock. But in a smaller organization, and that's most of our organizations here on that panel, we need our team to be flexible and say, well, there's no job that really is not mine. And I would actually argue that because of that, I learned how to do EKGs, I learned how to do EVGs, I learned a lot of things that maybe if I had gone to this big center, I would just have been, my role would have been just to chart. And it's easy to just chart, but it really, I think I became a better nurse because I had that opportunity to experience different things. So we're definitely looking for people that are adaptable and are flexible. Just like everybody else on the panel said, I think we need critical thinking. We need to be able to step back and say, what's going on with the patient? What's going on with the scenario? What could be causing this? Is this your tube is disconnected from the oxygen regulator? Is that why they're hypoxic? So you need to be able to step out of the box and think outside the box. Critical thinking is great. Teamwork, every one of us around this table will say, we need this. Everybody needs to work together in order to ensure that we put the patient in the center and we ensure that the patient, resident, the client receives the best care possible and the safest care possible. Communication and customer service is another big component. As CMS is shifting from a volume-based reimbursement to a value-based reimbursement, it's even more important. So we've worked a lot with nursing. The latest that we've done for us at Northern Maine Medical Center is bedside shift report. So we instituted that about 8 months ago. We hardwired it. The nurses go give a report at the bedside and include the patient and the family in the bedside shift. And we've seen our score from overall rating to go from 78th, 79th percentile up to the 94th percentile just by instituting that practice. So we're pretty excited about that. And then, like some others said on the panel, integrity, honesty is another big thing that we need to do. Sometimes we've got to rely on you. We're playing with people's lives. They count on us as an organization to provide them with safe care, and we've got to be sure that we've got integrity and honesty in delivering that. As far as what we have to offer, well, being a hospital, I've got a lot of things that we can offer from a physician. So if any of you wants to pursue and become a general surgeon, we can certainly talk about it. To advanced nurse practitioners, to nurses, to pharmacists, to occupational therapists, to physical therapists, social services. So I've got a really wide array of needs in our area. And some of them are actually going to come up with leadership positions. I have some business positions that are going to become available in the future. Our maintenance director in the next 5 to 8 years will probably retire, so that'll be a big position to fill. So, and most of us focus on healthcare, but the majority of us also have those additional needs, business needs, trade needs that we also need to provide our service and care for the population. The last thing I want to say is that we've got a pretty robust onboarding program. We've partnered with the Vermont Nursing Partnership Program. We've brought in an evidence-based practice of onboarding our nurses with mentoring that takes place for the next year after you're with us. So, so far the feedback has been very positive, and we're pretty excited about that. That, I will pass it on.
So I'm Priscilla, I'm from Lake States in Madawaska. I'm the director of nursing there. I've been doing that for a year now. I also work at Cary Medical Center still in Carroll. And I can tell you guys that for us in we're a 52-bed facility, and we age in place, which is a little unique. We admit our residents, and they're ambulatory and they're independent as their needs change. If they have a stroke or if they just the aging process, if they develop something different, we like to keep them there. So we adjust for their needs, and we have all the way, independent people that do total care patients who need a lot of help. We have a really great team. I worked at Ridgeway Estates as a CNA myself when I was in nursing school. I did CRMA as well, which is medication pass, like what she was talking about. And when you, I think if you're a nursing student and I have a couple people who did this, if you pass one with passing grade, you just provide a paper and they give you a one-day training and you can do a bridge program and you can automatically pass meds after you've taken farm. Those are really quick instead of taking the 40-hour course, you take a bridge program. I don't know if that's at your level of care. I know we can do it in our facility because we're doing it now. So we offer CRMAs mostly during college right now. We employ 8 UMFK nursing students. So we do really well with, they're not always available, we're aware of that. So we just kind of piece it together. We have a lot of short shifts, which they like because they can go to class all day and then fit a 4-hour shift and at the end, or come in the morning and do 6 hours and then go to class in the evening. So we try and work really, closely with them to accommodate them in their schedule. Trying to think what else we don't have a lot of post-grad opportunity for nurses because it's only me and one other person who relieves me on my days off. And the CRMAs run the show when the nurse isn't there. They are very knowledgeable and have a lot of experience. So I'm always on call. They call me if they have any questions and we address it that way. I'm trying to think if there's anything else. For while you're in school, so CNA, I have a nursing student who came to me and said, I have 0 healthcare experience whatsoever, and I'm in the nursing program. So we hired her, and she's doing fabulous. She loves it, and she's doing really well. So I think if you're in school and you want to just kind of get your feet wet a little bit, it's a great place to start. I know some of the girls who do meds are in farm, and they said, I don't know what I would do if I wasn't doing meds because you learn so much and get familiar with a lot of medications. And when I graduated from a nursing school, I had been in med tech for a couple of years, and I can tell you that when I graduated and became a nurse, meds was like the least of my worries. I had a lot of that, and I had to learn IV meds, but a lot of those didn't really worry me because I knew what they were for because I'd been doing it for a while. So it does really help you a lot. I think that's pretty much all I have to say.
Okay, so I'm Kathy Roy. I am the administrator over at Crosswinds Residential Care right here in Fort Kent on Village Road. So we are a family-owned business. We own Ridgewood Estates, and we also own St. Joseph's Memory Care. So we're all assisted living facilities. Ridgewood and Crosswinds are very similar. We're a 45-bed facility. And St. Joseph's is specific to dementia, so you have to have a dementia. So I'll speak about St. Joseph's, the nurse from there could be here. So St. Joe's, you have to have a diagnosis of dementia to be able to be admitted to that facility. So that's specific, but as far as operations, it's all the same. We're family owned, we're on a smaller scale. We employ a lot of CNAs, NAs, nurses aides, certified nurses aides, and certified medication aides. We do hire nurses, but like Chris said, we don't hire 5 nurses. We have, a couple per facility. So what we do is we take care of geriatrics. We have, we take care of them right on site. We do all of their blood work. We invite the visiting nurses to do physical therapy, occupational therapy. Doctors come on site and they do physicals right at the facilities. So as nurses aides, as the nurses, we assist those physicians. We're basically little communities under a roof. So we provide activities for the folks. We provide all of their meals, all of their medication administration. And so what we can offer UMFK students is basically a nice complement to your education if you are pursuing a nursing degree. So I always, when students come to us, and like Ridgewood, we hire a number. We have about 12 nursing students right now at Crosswinds, and it's wonderful. We have some of them work a little bit more than others. We work with their schedules. I always tell them when they come see me, bring your schedule. Let's see what we can do, where we can plug you in, because working at a healthcare facility while you're in school
is gonna take away so many, that anxiety when you walk into a patient's room. I remember in nursing school, that was one thing, I had no worries. Like, I just walked in, I was like, hey, I'm Kathy Roy, I'll be your student nurse today. Like, my clinical instructors knew, like, you've done this before. And I'm like, yeah, I work with people, you know, at Crosswinds, and they can tell. So you can kind of take away all of that nervousness of, you know, working with people by working as a certified nurse's aide. So we like, you know, so we promote, you know, the UMFK students to come to us and kind of get that, you know, get some hours in, get some experience. If you want to pass medications, we'll help you get through the classes. We pay for your classes if you're employed with us. We help you with your first aid CPR. If you're with us, we pay for all that, so you don't have to worry about, you know, I know your students, you don't have that much money, so every little bit helps. So we can pay for your classes. What else do we do? I'm trying to think. That's about all I can think of. Oh, I do another thing. So we do hands-on training, and that most recently is I just accepted an intern. So I'll have an intern, a student from UMFK in the health administration program who will come work with me. So that's also another opportunity if there's any of those students in the crowd. But that's about it.
Great. So thank you so very much. Now, is there any questions from anyone at this time? Because this is your time, if you have any questions. If not, then I highly invite you to take part into some of the treats that we have that are available for you, and the snacks, as well as you. And this is a time to meet and greet. This is a time that you can actually talk to. Yes? I'm sorry.
I have a question.
Oh, okay.
I don't know
On the plate.
And I want to make sure
That's creative.
I want to make sure the students hear you guys' answers. So, if a couple of you could tell me, or tell them, me too, because I'll tell them, what would be, I talked to them a lot about transferable skills, kind of the skills that they can gain that transfers across, not the clinical skills, the accounting skills, or the IT skills. What are some transferable skills? If you guys could give me like 3 of your top transferable skills that you think is important for students to be mindful of now.
How do you, I think Kathy said it best, she was comfortable going into a room because she had done that before. So being comfortable talking to people and being able to connect with somebody really quickly. I go back to my years of being an emergency room nurse, and somebody's coming into, you know, they're coming into the emergency room with a critical condition, and we have to take care of them, and they're scared. And so being able to connect with that person quickly and being able to gain that trust quickly, because people do trust nurses, and being able to do that, that is a transferable skill, the ability to connect with people. And then Erin said it with critical, good assessment skills. It doesn't matter what field of nursing you work in, you need those really strong assessment skills. And it's basic nursing, but to say, if it doesn't feel right in here, that you think something's wrong, it's probably right. There's something wrong, we just gotta find it.
And Jane, you don't even know it, but you had mentioned some when you first spoke was work ethic and problem solving.
Yes.
Some of those transferable skills as well.
Sorry, I think no matter what field you're in, I'm not a nurse by trade. I'm in social services, I'm going to be a social worker. So I think being in the nursing home, yes, I see a lot of the skills you're talking about, but being in any field, they want to talk, really be customer service. Kind of like what Jane was saying, feeling comfortable with the patient and meeting their needs. So customer service, I would say versatile. You know, being able to jump, whether you're working for a nursing home and having to go down to the residential care unit, or maybe you're in the hospital and you're jumping from OR to med surg or something like that. So being versatile, being willing to expand your knowledge and not just focus in one area. So in a nursing home, you're thinking we have only geriatrics, but we've actually had
folks that are 20 or 30 years old looking at us. We've had folks with a lot of mental health conditions or folks with developmental disabilities. It's not just geriatric care we do. So being versatile, as well as committed to the organization you work for, committed to the patient you're caring for. I think the top three I would say.
Yeah, another one I'd like to say is having perseverance. I've worked nights, I've worked evenings, I've worked days, I've worked at the long-term care facility, I worked at the hospital, and at some point, somewhere, I had a bad day. I had a shift that was just busy, and right now they're referring healthcare as a constant state of turbulence. It's not that there's constant change, whether it's from the insurance companies, whether it's regulatory, whether it's the customers. The customers are really changing the way we're doing business with Google Doc, that they're going to look and then they're coming in and they're saying, well, I should be getting this medication because Google told me so. So it's the ability to persevere through all of this and find a way to say, we're going to get through this. We're going to get through this shift today. And to stay engaged. Stay engaged. Go see your administrator. Go see your nurse manager. Go see your CEO and say, listen, this is my idea. I think we can do this a little bit better. We all want that in our people. We want people that are engaged, and I've worked at a few different organizations, and that's all that they were looking as well.
So students, when I say join a club or an organization, get engaged, diversify, take on some leadership roles, that's what they're all looking for in you guys, okay? I don't know everything, but I do know some of those things. Thank you for reinforcing that. I appreciate it. I think Heather or Denise, one of you may have spoke to this already, but what are some good jobs at your organizations that college students could work at? And not just our nursing students, but our students in general. We have some business students in our audience, we have some nursing students in our audience. We have behavioral health students who are here and they had to get to class, but we have a diverse group. I don't think you have jobs for our forestry students, but maybe. Yeah, right. They have all these connections to students.
I mean, I think any organization, I think we all kind of touch base, whether it's maintenance, you're going, clearly UMFK doesn't teach the trades, but maybe you have a significant other that's going to school to be a plumber or a heating specialist, and all of us have a maintenance program somewhere. We all need maintenance. There's housekeeping, you're that freshman, you want to start thinking you want to go into the health field, you're not 100% sure, maybe you want to get your feet wet, but you're not ready to be a senior. You can start in housekeeping, you can start in laundry, you can start as in, some of us call them gophers, some of us call them caretakers. You can handle meals, you can, for example, I want to touch base on things changing. Healthcare changes so much. So reimbursement for skilled care in nursing home has been years driven by physical therapy, occupational therapy, and speech therapy. Come October 1, it's now being driven by nursing care and the skills and the amount of nursing services someone's being provided. But to do that correctly, we need someone to code our diagnoses quick. So we need those people sitting in our central office coding our diagnoses and understanding medical correctly and quickly to get better reimburses to capture on paper what the nurses are doing. So yes, I mean,
so accounting students might be good for that because they're detail-oriented and stuff like that. Great.
Tammy, if I may too, I think the other thing to consider is for students that if you get into one of the Health Ally organizations at this table, the clock starts for benefits, a lot of benefits. So depending on what the array of benefits are, if you started, say, at 20 hours because you still have school, for example, at our organization, retirement benefit clock starts. So you don't have to wait for that retirement benefit 15 months later from the day you start. Typical career path after graduation. So a way to look at it is you can advance that clock for benefits if you started at one of these organizations before you get out of school. And then you're not waiting 12 to 15 months to start some of those benefit clocks that take time to start.
Yes.
I wanted to just share my own experience when I was in college. I worked doing that job. It astounded me every time I went to work. I learned something new. So don't ever discount an opportunity that you might have while you're in college to be in the healthcare environment. That I 100% agree. Just passing out meal trays, working as CNAs, as CRNAs, as secretaries, as receptionists even. You're learning so many skills that are transferable later. Like Tammy was asking about, in manners count. So being able to answer the phone, hello, and sir, this is Erin, how can I help you? That I used to do it at home. Can I help you? But it counts, it all counts, and those are transferable skills. That comfort level you have, like Kathy said, with being able to go in and say, hi, my name is Erin, I'm a student nurse from UMK, I'm here with you until 7 this evening. If you ring your bell, I'll come see what you need. That counts, and it seems like such a small thing, but when you're in the environment, you realize it's a big thing. So embrace every opportunity that you might have in the healthcare organization. You're going to learn every day.
Tammy, we have business program too at UMK. It's called Live Safe, or some people know it as a life alert button. But that too is something that, and I think there's some positions open right now for that. That's another opportunity if you have an interest in home care. It gets you into people's homes, you're installing equipment, you're troubleshooting, you're doing some teaching. So whether it's social services you're in, or nursing, or IT even, because there's that component to it, that is something else. And I'd like to put a plug in for a program too. It doesn't pay, but it's a faith-based, multi-faith-based volunteer program that we're starting to visit members in our community who may not be affiliated with home care, or they don't get out of their home, but we've gone through the churches to see if we can find people that we can go visit. So if you're interested, call me, please.
And we're going to have their contact information, okay, so you don't have to remember it all. We'll have it, Sue, Nick, and myself, so. And that leads nicely into, Jane, my next question. I'll make it my last question. Volunteer opportunities. We may not be able to employ our students, but what are some volunteer things that we can do? We're gonna have the nursing home, I mean, activities.
I love volunteers.
Yes, right?
Come on, anytime, any day. Yeah, we have, I mean, a lot of, I know Snow comes in, so some of you might have come in, just to do arts and crafts with our residents. I mean, some of these folks, they get a lot of visit, but some get very little visit. So just visiting with them, taking them outside for a walk. There's so much. I mean, we can't run these facilities, like I know for our facilities, without our volunteers. We have a luncheon every May for the week on volunteerism, and we serve meals to over 50 volunteers in the community because they mean so much to us. And always remember as students that every act, everything you do as students, as any day, you're building your resume. Everything, you're coming into Crosswinds. I've hired people because they have a lovely smile, by the way. Because if you come into my room and I'm sick and you have a nice smile, my God, I already feel better. So just always remember how your actions. When you go get a job while you're a student, just remember, like, you've made a commitment to that facility, so that also will follow you. So if you say to any of us, I can work 15 hours, perfect. So just make sure that that's your commitment and you can do that. And if you can't do that, that's okay, come tell us. Come sit with us. Like, I know I'm an open door, my door's always open. I want people to feel, my employees, the folks that work at Crosswinds, the volunteers, that they can come in and chat with me anytime. So just, they say we're the most trusted, nurses, folks at careers. So let's keep that going by showing the world that, we're caring.
I didn't pay Kathy to say that.
No.
You're welcome. So I'm done. My questions are done.
So basically, we'd love for all of you to network with each other if you would like. There are snacks over by Sodexo, and they always put on a wonderful spread. And then I think it would be a wonderful way of us saying thank you to these presenters. So if everyone would join me.